Hello and welcome to the Art of Being Human. I'm going to start today and talk about cannabis or marijuana, what the symptoms are of use, what the withdrawal symptoms are, and get into it that way, because I know that there are a lot of people using marijuana, and I know that it does have some medical uses that are very, very helpful. But I'm just talking about cannabis, people just taking it, getting maybe high from it, and what the withdrawal symptoms are if they're using it as a recreational drug. Well, the symptoms of use as a recreational drug is euphoria, anxiety, suspiciousness. The time slows. Now, what I mean by that, time slowing, is that a person may be resting and they wake up every so often, like they're taking a nap, and maybe only a little bit of time has passed, but it feels to them like a lot of time should have passed. I remember I took a medication that was prescribed for me by a doctor. I don't remember what it was for now. I think it was for a bad cold or something like that. And it made me drowsy. I went to sleep, but it slowed time for me, which I didn't like very much. It's like I would sleep, and then I'd wake up, and maybe only 5 minutes had passed, and I thought maybe a half hour should have passed. And it's not really a fun thing to go through, because it seems like time takes forever. So time slows. That's what that's talking about. It gives poor judgment with withdrawal, wanting to withdraw, tachycardia, which of course has to do with your heartbeat, redness of the eyes, a greater appetite, and if you have too much hallucination. So let me just read that group of symptoms once again. Euphoria, anxiety, suspiciousness, that is, you're suspicious of everybody, time slows, poor judgment, withdrawal, tachycardia, redness of the eyes, a greater appetite, and hallucinations. Now, what are the withdrawal symptoms? Well, the withdrawal symptoms are restlessness, irritability, insomnia, and loss of appetite. Those are the withdrawal symptoms, and they usually occur immediately after you have stopped using the marijuana. They can last for 3 days. Those symptoms can last for 3 days, but if you're eating the marijuana, it lasts longer. So that's something to keep in mind. Now, cocaine, the symptoms of use of cocaine, it is a hard drug, and large doses can give you convulsions and death. Why death? Because it changes the heartbeat, so you get a heart problem, and it can give you, believe it or not, respiratory paralysis. It can actually stop you from breathing right, and that can kill you as well. So the symptoms of use of cocaine: euphoria, fighting mood, grandiosity, I've mentioned that before with other drugs, feeling that you're just so great and you're the most powerful and nobody else can meet you and all of that. Hypervigilance, which means you have to watch everything and make sure that everything is all right, because you have to watch everything. Somebody might be trying to do something to you. Psychomotor agitation, the movement, poor judgment, tachycardia, change in your heartbeat, high blood pressure, dilated pupils, perspiration and chills, nausea, vomiting, hallucination, and delirium. Now, this is a lot like when I talked the last session about the symptoms of use of heroin. It's a lot the same. Large doses will give convulsions and death due to heart arrhythmias, changes in your heart rate, and respiratory paralysis. Now, what are the withdrawal symptoms of cocaine? Depression, anxiety, irritability, fatigue, insomnia, hypersomnia, in other words, much too sleepy, psychomotor agitation, the constant moving, paranoia, suicidal ideation, the thoughts that you should kill yourself, apathy, which means you just don't care about anything, you can't get invested in anything, and withdrawal. It's interesting when we talk about withdrawal, because some of people who are taking drugs, what they want to do is withdraw, so people will leave them alone so they can get high and be by themselves. And yet, they're not happy being isolated. But of course, you can't have it both ways. If you want to be alone to use drugs, then you can't complain about being alone because you're using drugs. But this is what people do. What about inhalants? Inhalants are used for asthma and hay fever, but they have symptoms. You can get addicted to an inhalant and say, here are the symptoms of too much use. Belligerence, that means you're ready to fight. Assaults, apathy, poor judgment, dizziness, nystagmus, which has to do with the fluttering of the eyes, slurred speech, unsteady gait, lethargy, depressed reflexes, tremor, blurred vision, stupor, coma, euphoria, and an irritation of the eyes, nose, and throat, because in an inhalant you're breathing it in and you can irritate your sinus cavities and your throat. Now, intoxication can occur in 5 minutes if you have too much, and it can last from 60 to 90 minutes. Large doses will lead to death due to a depressed nervous system or a depressed heart. And there are no withdrawal symptoms. You either are intoxicated or you're not. There are no specific withdrawal symptoms listed for the inhalants. What about tobacco? Now, there are over 4,000 chemicals in tobacco. This is what I've read. Now, I'm assuming that some of these are trace elements, but there's no way that I can figure it out for sure. I know that what's listed in tobacco, I'm going to give you a list of what's in tobacco. The chemical substances that are included in tobacco are acetone, arsenic, which is a poison, benzene, cadmium, chlorine, formaldehyde, propylene glycol, ammonia, carbon monoxide, nitrogen sulfide, hydrogen sulfide, phenol, and arolane. Now, these are a lot. Now, I'm assuming that they're trace elements, but I'm not sure. Tobacco, what happens in tobacco when you're smoking is that it shrinks up the blood vessels, and it'll go into your hands, your fingers and your toes first, the peripheral part of your body. It'll affect that first, but they'll take those smaller blood vessels and shrinks them or collapses them so you don't have circulation. There is an illness called Buerger's disease. The only way that you can get it is to smoke. That's the only way you can get it. And I'm not saying all smokers get it. It's not that usual a disease, but you can get it. If you do get it and you don't stop smoking, it's just about a death sentence, because it goes from the periphery to larger blood vessels, and it shrinks them, collapses them, and then you lose your circulation. When you lose your circulation, the parts that don't have the blood vessels or don't have the blood supply will die. Some parts will turn black, and then some of those parts will drop off. It will actually drop off your body. You know, I saw a person who had some toes removed, and it was all gangrenous. It was like by her toes, she had gangrene. Part of her feet was black. And you knew that what was happening was she wasn't getting any of the circulation that she was supposed to get. And parts of her toes and her feet were just dying. Well, she didn't live too long after that. You know, she just didn't. So if you have Buerger's disease, it's not spelled like burger, B-U-R-G-E-R, like you're going to a Wendy's or something to get a hamburger. There's a little different spelling to it, but it's pronounced Buerger's disease. It shrinks up the blood vessels. It causes them to collapse so that they don't have the circulation, so your body does not get the circulation, and parts of your body are dying from lack of circulation, and usually it means that you're going to have amputations to see if they can spare the rest of your body. But if you don't stop smoking, the same thing's going to happen to the rest of your body. Eventually, it's death, and it's also a painful disease. Your body is basically shutting down from lack of circulation. So it is always wise if you can get away from tobacco. I know it's hard to quit. I've been told it's hard to quit. I don't smoke myself, so I just take this information from friends of mine who say it's it's very difficult to stop smoking. But at any rate, it's good if you do. When you quit smoking, there are certain benefits. Your blood pressure and your pulse rate will become more normal in about 20 minutes. The oxygen in your blood will become normal in about 8 hours. Your heart attack risk is going to drop in 24 hours. Your smell and your taste is going to improve in about 2 days. Your breathing and lung capacity is going to be better in about 3 days. And your circulation is going to be better anywhere from 2 weeks to 3 months. So you see there's a span of time here. Your energy, respiration, sinus problems, breathing, coughing, all of that stops between 1 and 9 months. So there is a span of time where you gradually get better, but there are some improvements that happen within a few days if you can stop smoking. It's a very difficult thing to stop doing, but you're much better off if you stop smoking, if you can do it. Now, nicotine has no symptoms of use, but you do get withdrawal symptoms, and this is what nicotine, the withdrawal symptoms are. You'll have craving, irritability, anger, frustration, anxiety. It's hard to concentrate. You'll be restless. You'll have a slow heart rate, increased appetite, weight gain, tremor, headaches, and insomnia. Now, you may not get all of these things, but even if you have a few of these things, when you stop smoking, those are things that you have to battle with because they make you feel terrible. If you can consider you're angry, you're frustrated, you're craving, you can't have that cigarette because you're going to stop smoking. I know so many people who have stopped smoking and gone back to it because they just can't seem to kick it. But it is good if you can kick it. The withdrawal will usually begin about 24 hours after your last use of cigarettes, and it decreases days and months and weeks longer. It just gradually, the symptoms just fade away. Nicotine is it stimulates the sympathetic nervous system, and it gives you increased heart rate, increased blood pressure, increased oxygen consumption, and also contracts your gastric muscles. There is nothing really good about it. Okay, so let's go to heroin. Heroin kills more drugs than any other drug. And what addicts want most of all is to be left alone to become high. And yet at the same time, they feel agonized by the fact of their own isolation. So as they say, you really can't have it both ways. The feeling of being high is so intense that nothing else matters if you're a heroin addict. And the same is somewhat true of alcoholism. The most common emotion during a period of time when the person is addicted to heroin is the feeling of isolation, but it is also the most sought out. So there are two things happening. You want to be alone to get high, and you fear being alone. So, two opposite things. That's the most common. There's been a 60% rise of deaths from heroin, and people, of course, get addicted to drugs. They get addicted to sometimes prescription drugs, which can be very expensive, and they find that heroin might be a little bit cheaper, and so they jump from their drugs that they're supposed to be taking under the supervision of a doctor and do heroin instead. And that's the way that a lot of people get to be heroin addicts. Now, there is, I think, maybe a predisposition, genetics, for people to be involved with drugs. I can't prove it, but I think that usually drugs are used for self-medication, but I think that some people are more drawn to it than other people. I mean, I will look at a pill, and they'll say the side effects are, and I've already rejected the pill. I'm not going to take it if it gives me too many side effects. But when you get heroin, when you're using heroin, you get a surge of dopamine, and it gives you a sense of euphoria, and it gets into the spinal cord, and the breathing decreases, and you can actually stop breathing, and the pupils constrict, and you have the dry mouth, you have decreased bowel mobility, and an infection of the heart and lungs. There's just so much that goes on with heroin addiction. It is so difficult, and you may not die from a heroin withdrawal, but it'll be a very, very difficult withdrawal period to get off from it. You know, most alcoholics just want to get high, and most heroin users also just want to get high. So there is kind of a similarity between them. It takes 6 or 7 rehab attempts before success happens, and the first few days are difficult. The worst symptoms are the first symptoms, and they last for the first few days, and then they gradually decrease. I heard one person say, you know, at first when I started to get off from drugs, I was afraid I was going to die. The symptoms were so bad, excuse me, I was afraid I was going to die. But then I was afraid I wasn't going to die, because by that time I wanted to, and I couldn't. So heroin withdrawal will be very difficult, but may not kill you. And yet other types of withdrawal, which I've already mentioned, can kill you. Now I'm going to use, this is the symptoms of use. I'm going to use, just in a general sense, talk about heroin, morphine, codeine, and opium, the harder drugs. Heroin, morphine, codeine, Demerol, Percodan, and opium. I'm going to be talking generally about the symptoms from the use of those drugs. I'm not being specific as to each drug here. I've already kind of done it, so I'm going to just talk about them generally. Here are the symptoms of use of those hard drugs: heroin, morphine, codeine, Demerol, Percodan, and opium, all of them related, by the way, in terms of their structure. The symptoms of use are going to be euphoria, lethargy, somnolence. That means that you're going to be tired, very tired. Apathy, dysphoria, and by the way, I am going to be defining these terms in a bit. Bad judgment, the pupils constrict, drowsiness, slurred speech, constipation, nausea, decreased respiration, in other words, you're not breathing as well, and low blood pressure. The withdrawal starts usually 6 to 8 hours after the last use of any of these drugs that I've mentioned, and it peaks in 2 to 3 days. So you start out and you're sick, you don't feel good, and you want the drugs to stop the illness, because by now, drug use is not pleasurable. You use it and you want to get high, but you want to get high to stave off the illnesses that you have with the withdrawal symptoms, because they're so serious. Now, so 6 to 8 hours after the use, the withdrawals are going to start. It's going to peak in 2 or 3 days, and probably 7 to 10 days, it will start phasing off, so the symptoms won't be so bad. So you have a good 10 days or so of a lot of really bad illnesses, really bad symptoms before you get off from it. And if you're taking methadone, which is used to stop people from using the harder drugs, because you can't get so high with it, but still you will have a longer period of time to get off methadone. The withdrawal symptoms are going to be the craving, nausea, vomiting, muscle aches, the pupils dilate, sweating, diarrhea, insomnia. Okay, those are withdrawal symptoms. The symptoms of overuse are the symptoms that I gave you before. These are the withdrawal symptoms. Now, what about sedatives? The symptoms of use of sedatives. Sedatives kind of calm you down. You have mood lability, in other words, your moods are all over the place, poor judgment, slurred speech, incoordination, unsteady gait, attention is impaired, the memory is confused, and there's confusion. And the withdrawal symptoms are going to be nausea, vomiting, malaise, which just means you don't feel good, weakness, tachycardia, sweating, anxiety, irritability, tremor, insomnia, seizures. The withdrawal may progress to delirium in 1 week after the use, depending upon how much you've used. Now, what about alcoholism? Alcohol is a natural substance, and it's a reaction of fermenting sugar with yeast spores. And the alcohol is called sometimes ethyl alcohol, and abbreviated ETOH. It is considered to be a food. Alcohol is considered to be a food. It has no nutritional value at all, but the fact remains that it has calories, and as long as it has calories, it's classed as a food. And there are different alcohol drinks due to different sources of sugar in the fermentation process. For example, beer comes from malted barley, wine from grapes, rum from molasses, and whiskey from malted grains. And it is a depressant. It will depress the CNS, the central nervous system. It will cause behavior and mood changes, and the effects depend upon how much has been drunk. Intoxication is considered from 0.08 to 0.10%. The body burns alcohol at about 0.5 ounces an hour, and the effects will depend upon how much you drank, if you have eaten, and it depends also upon the person's size and their weight, and if a person is stressed or tired. Now, half of Americans 12 years old or older do drink alcohol, and many people drink to relax or to celebrate or for special occasions. But alcohol is in many ways in over-the-counter medicine, and alcoholism is considered to be the third leading cause of preventable death in the United States. The first cause of death, and this is kind of a hard thing to say, but the first cause of death in the United States is abortion, the killing off of babies. The second cause of death among teens especially is suicide, and the third cause of death in the United States is alcoholism. Now, alcoholism is considered to be the #1 health problems. It strains the healthcare system. It puts a strain on the economy. It harms families. It threatens public safety. It causes 1/4 of all emergency room trips. It causes 1/3 of all suicides. It causes 1/2 of all homicides and domestic violence cases. It contributes to heart disease and cancer and stroke. And you have, of course, the fetal alcohol syndrome, which causes, and this is when a baby is born being addicted because the mother was drinking, and it's the leading cause of retardation among children. There are 4 phases. I'm going to try to finish this. I don't have too much time left, so I'm going to try to finish this. There are 4 phases of alcoholism. There's a pre-alcoholic phase when alcohol is used to relieve stress. And of course, children watch their parents drink and they think it's normal. It's a normal lifestyle. And they develop a tolerance, and the drinking tends to increase during this phase. Then the second is early alcoholic phase, where you have blackouts and you have brief amnesia following drinking, and the alcohol is now required. You are now addicted, and it's not pleasurable, but you have to drink to stop the symptoms, withdrawal symptoms. There's secret drinking, sneaking drinks, and getting alcohol, drinking it fast just to get it in your system, and the feeling is guilt and defensiveness because everybody knows that you're probably an alcoholic. The third phase is a crucial phase where the alcoholic loses control. They're physically dependent. They do binge drinking. They're sick. They lose consciousness. They have anger episodes. They're aggressive. They're living in squalor. They've lost everything. Their families are gone. And the drinking is a total focus. They're willing to lose everything just in order to have the next drink. They lose their family, their jobs, their marriages, their self-respect. They lose everything. Then the chronic phase, which is the 4th phase of alcoholism, when they are emotionally and physically disintegrating, when the body is shutting down and they feel helpless, they have a lot of self-pity, they can even become psychotic. Every system of the body is shutting down. And to stop drinking gives such terrible symptoms such as hallucinations, tremors, convulsions, severe agitation, panic, depression, suicidal ideation. The person has to drink. They also have have to be treated. What happens in the body is that the alcohol depresses the central nervous system, 20% of the body. It doesn't have to digest. It gets into the stomach. It goes directly into the bloodstream, most of it from the stomach, because it doesn't have to digest. And from the stomach, it goes to the brain and depresses the brain. What doesn't go through the stomach to the blood system, it gets absorbed through the rest of the digestion, the intestinal tract. So from stomach to blood, then to brain, slowing the brain is a very serious disease. The other 20% of it does this, and the other 80% just gets absorbed. Now, I don't really have time to finish this, so I'll finish this next time. I was hoping that I would be able to finish it this time, but we will be finishing with alcoholism next time, so we'll close it here. Please join me next time.